Hello, and welcome to this ninth edition of this CCD Rounds. CCD stands for Cities Change Diabetes, a global program working to address urban diabetes with a focus on the most vulnerable populations around the world. My name is Niels Lund. I'm the global lead for Cities Change Diabetes, and I'm Vice President of Prevention and Health Promotion in Novo Nordisk. The partnership of Cities Change Diabetes was established in 2014 and has grown to more than 40 cities now. Actually, just a few weeks ago, city number 42, the city of Venice, joined the network. And with such a growing number of cities as part of the network, we have a fantastic opportunity to learn from each other, bring in experiences and best practices and so on. And this is the whole purpose of the CCD Rounds, sharing and learning from these good experiences. We've actually most recently collected 18 of the best practices, including the one we are going to hear from in a few minutes, as part of a case catalog that is now available on our website. There are 18 so far, but there will be more to come. But today we'll have not just one, we'll have 4 speakers from the city of Madrid that we will hear from in a few seconds. And I'm really happy that Antonio Pietro, Mercedes Chenos, Dario Ochoa, and Vanessa Sanz from Madrid Salud have joined today. They will present the Madrid Alas program, which focuses on food, physical activity, and health for the citizens of Madrid. The program is intended to create behavioral change and promote a healthier lifestyle. So our guests will speak for half an hour or so, present the program and its learnings, and then we'll go to a Q&A session afterwards. And if you already now have a question that is burning on your tongue or your fingers, then press the question mark to the right side of your screen and then type it in, and then I will bring it back into the conversation after the presentation. But enough for me. Let's jump right into it, and I'm happy to give the word to our first speaker, Mr. Antonio Pietro, who is the General Manager of Madrid Salud.
And welcome to the presentation of Food, Physical Activity and Health Program of Madrid Salud. My name is Antonio Prieto. I am the General Manager of Madrid Salud. Madrid Salud is the agency responsible for health promotion and disease prevention in Madrid Salud, in Madrid City Council. In the city of Madrid, we are aware of the importance of addressing obesity and preventing type 2 diabetes to improve the quality of life of citizens. With this objective, we have been working for 11 years through the Food, Physical Activity and Health Program to promote a healthy lifestyle and prevent diseases. We believe that our participation in the City Change Diabetes project will boost our action in this regard. Now, the Madrid Salud professionals who work in this program are making the presentation. Thank you.
I want to introduce Dario Ochoa and Vanessa Sanz, who are part of the program team, and they will present today as well. We rely on the presentation with slides to have some support with the language, and we hope you can understand us. We display the following topics: presentation of Madrid Salud, and presentation of the Food, Physical Activity and Health Program and its objectives and basis, population strategy, the high-risk strategy, alliances with other organizations, the program during the COVID-19 pandemic and lockdown, the childhood obesity prevention project, and some research studies. Madrid Salud is the institution responsible for health promotion and disease prevention, and Madrid has 21 districts and 131 neighborhoods, in which there are 16 municipal community health centers distributed all over the city. We work in multidisciplinary teams with professionals from medicine, nursing, gynecology, psychology, social and educational work, nutrition and physical activity professionals. We address the main health problems with 9 health promotion programs. And one of these programs is Food, Physical Activity and Health Program. In Spanish, we call it Alimentación, Actividad Física y Salud, or ALAS program, ALAS program. Why did we decide to start this program? Well, we all know that obesity and type 2 diabetes are considered pandemics of the 21st century due to their high prevalence. Within the people adult of Madrid, 47% of people are overweight and 12% of them are obese. 10% have type 2 diabetes, 29% have pre-diabetes, and in the childhood, 41% of children are overweight and 16% of them have obesity. Besides, cardiovascular diseases are the leading cause of death in Madrid. For these reasons, we decided to start the design of the ALAS program in 2010, with the objective of preventing these chronic diseases through a change in lifestyle. And for doing so, we reviewed similar experiences in scientific literature through a change, like the Diabetes Prevention Program and of the USA. We have been carrying out this program for 11 years. The program is to reduce the prevalence of obesity and type 2 diabetes, and finally, the cardiovascular diseases, promoting a healthy diet and regular physical activity to achieve a healthy lifestyle. And the basis of the program are the following. First, intervention with people. The population strategy is one of the strategies of the population strategy. The population strategy is aimed to all citizens with awareness activities and interventions in the urban environment. And the high-risk strategy is aimed at people with obesity and pre-diabetes. And the other base of the program is the alliances with other organizations with similar objectives. The general goal of the population strategy is to promote a healthy diet and the practice of physical activity among the citizens of Madrid. And for this, we do community interventions, group workshops, website and media communication, and actions in the urban environment, like healthy routes and urban gardens. Now I will briefly explain each of them. In the community interventions, we try to be present in places where people can see us and talk to us about these topics. For example, on the street, in markets, in pharmacies, in district celebration, in commemoration day, and so on. We use tents, posters, games, healthy words, and others. You can see in the slide some examples of these activities. The health fair, the National Nutrition Day, the breakfast in the city's hall, the World Diabetes Day, or the European Mobility Week. Since 2011, we have worked with more than 1,100 people. We also developed interventions with specific groups of people. We think that it's very important to work on healthy habits since childhood, and that's why our activity in schools is very intense. In fact, we work with more than 325 schools in Madrid, organizing workshops about healthy food. I want to remark the workshop that we have carried with more than 3,200 people with intellectual disabilities, adjusting the content and materials for their needs. Obviously, we also organize workshops for adults and older people, usually in the places where they meet, such as cultural centers, sports center, neighborhood association, and others. In these 11 years, we have worked with more than 100,000 people. Other actions aimed at all the citizens of Madrid is our website. In there, people can find interactive games and videos related to food, information about the program, healthy routes to work through the city, and plenty of healthy menus from our healthy and economic food project. Moreover, we also try to be present in social media and in mass media, for example, in press, in radio, or in TV. Our second line of work as part of the population strategy is the interventions in the urban environment to promote the practice of physical activity. We have designed 21 healthy working routes in the city as parts of Project Working People. 2 of them across the city center from north to south and from east to west, and the other 19 routes are in different districts and close to the municipal health centers. In total, there are more than 105 kilometers indicated all over the city. At the beginning of each route, there is a map with some relevant information and tables with the speed and the estimated caloric consumption. Then, the path to be followed is indicated the street furniture, for example, in the street lamps or in bins. The professionals of our centers organize and accompany groups of people to work, and Nordic walking is also carried out on these routes. There is an application called Rutas Web Madrid Salud that can be used to follow the different routes. And finally, as part of our interventions in the urban environment, we have urban gardens in 3 of our centers. These community gardens provide benefits to the people who participate, such as contact with nature, education on healthy and sustainable eating habits, and promotion of social interaction among neighbors. In all these activities, both the program brochure and the fine risk test are given to the people to detect high-risk population. The second strategy of the program is the high-risk strategy, which will be presented by my colleague, Vanessa Sam.
Thank you, Mercedes, and thanks to CCD for giving us this opportunity. First of all, it is essential to know who is people at higher risk of developing type 2 diabetes or obesity, to work more intensely with them on changing their unhealthy habits. For detecting high-risk population, we use the fine risk test, a useful instrument that you probably already know. This test has 8 questions related to age, BMI, abdominal circumference, physical activity, consumption of fruits and vegetables, and personal and family history of diabetes. People with a score above 14 in the fine risk test have higher risk of developing diabetes, and in some cases, they even already have it. With this data, we identified which groups of people are in need of a more intense work. The general objective of this high-risk strategy is an intensive intervention about healthy food products, food labeling, the effect of nutrition and exercise on health, and the fact that unhealthy habits can be changed to prevent chronic diseases. The specific objectives are that people increase their adherence to the Mediterranean diet, which means more vegetables, fruits, red products, and that people practice 30 minutes of moderate physical activity at least 5 days a week, and to achieve a decrease of 5 to 10% of body weight in 6 months. In order to achieve those objectives, we work both with groups and individuals. But people receive their individual assistance in medical consultations. In them, the doctor or nurse does an exploration an assessment of the habits through a questionnaire and blood analysis is requested, included a glycemic and lipid study. With all this information, people are classified into 3 groups: people with overweight or obesity, people in a pre-diabetic state, and people with diabetes. The target population of the program are people with a grade 2 overweight, obesity, and in a pre-diabetic state, and they are offered to participate in the lifestyle change workshop. People who are diagnosed with diabetes and that didn't know about it are referred to the primary care doctor, and they are also offered a diabetes education workshop in one of our centers. Now, the lifestyle change workshop is organized in 10 sessions during 6 months, in which 15 to 20 people participate with 2 professionals in each session. A standard session of this workshop consists of reviewing their tasks and commitments, talking about the difficulties they are going through or doubts they may have, the content of the session itself, and tasks and commitments for the next session. Of course, always taking into account the emotional baggage. Now, I'm going to talk about frequency and content of the session. The first 6 sessions are weekly, then bi-weekly, and finally, they are spaced out a bit more until the workshop reaches 6 months. Regarding the topics, we talk about healthy food, buying groceries, cooking, healthy menus, how to prevent relapses, or the planning of special occasions. And we recommend to reduce their calorie intake if they need. The last sessions are considered just recap sessions to do the follow-up. While doing this work, we also take into account the emotional baggage, as I said before. In fact, we have a specific session for talking about their thoughts and emotion as a list of these changes process. Well, the methodology of this workshop uses the group as a very powerful tool to encourage lifestyle changes. Moreover, we work with specific and quantifiable commitments. In fact, the participants are involved actively and they have a homework book where they write down what they ate, their physical activity, and their weight. We also give the participants tools for valuing their emotions, and we highlight the role of the psychology professionals in this program. Finally, we try to redesign the environment that surrounds the participants to transform it into a facilitator of our goal of changing unhealthy habits instead of remaining a problem. To encourage exercising, people participating in the 6-month lifestyle change workshop are offered to take part in physical activity groups with a price reduction to encourage attendance. This referral is done through a sports prescription to the municipal sports center of the district. In this way, health professionals and physical activity professionals work coordinated to improve the results. Well, in addition to all the work that is being developed in municipal health centers, since 2014, we have also implemented the ALAS program in the workplace, reaching more than 3,100 people. We have worked with workers of the Madrid City Council, the tax agency, or the accounting court, among others. We are also currently working with the public transportation. Therefore, to sum up, what is about high-risk intervention? First of all, is the detection of population at risk. Second, individual and group intervention and physical activity. And lastly, the evaluation. The first evaluation is at the end of the 6-month lifestyle change workshop. And later we do 2 more, 1 and 2 years from the beginning. Now, let's talk a bit about some results we already have for this strategy. Since 2011, we have carried out more than 40,000 interventions. About 11,100 people have been diagnosed with overweight or obesity. Almost 3,000 people who scored above 14 in the film-risk test carried out glycemic study, and 63.5% of them had alteration. 1,546 of them presented prediabetes, while 446 discovered that they were actually diabetics. Almost half of the total of high-risk people participated in the lifestyle workshop, included people with diabetes, prediabetics, okay? And people with unknown cases of diabetes were referred to the primary care centers to receive the treatment and were offered diabetes education in Madrid Salud Diabetes Center. According to the results of a research study carried out on 1,629 people who participated in the intervention, some results are as follows. Regarding weight reduction, that 85% of the participants lost weight with an average of 4.3 kilograms. More than half lost it 5% or more of their baseline weight. And 1 out of 4 didn't have obesity after the intervention. Regarding the prevention of diabetes, it must be noted that 35% of people with prediabetes end up normalizing their glycemic status. When analyzed by gender, the results were better in men than in women. 48% of men and 28% of women, and improved their glycemic status. In fact, it is relevant to mention that even if less men participate in the workshops, those who do it have better results than women. And in addition, we have verified that these results are maintained over time. At the bottom of the slide, you can find the link to the full study. And well, now we have finished the explanation of our population intervention. So it's time to talk about the second pillar of our ALAS program, the alliances with other organizations that have similar objectives can enhance the results of the ALAS program. And that's why we work actively to build those alliances. So my colleague Dario Ochoa is going to present this last part.
So let's talk about alliances. We work in coordination with other municipal areas and also with external organizations. Some of the municipal areas we work with in some projects are the General Directorate of Sports. Together, we carry out activities in health promotion and physical activity. The Urban Planning Area that helps us design and elaborate the healthy routes in the city. The Occupational Health Service that supports us in the implementation of the program in the workplace. The Social Services Area to promote healthy food among people in a social and health risk situation. As I mentioned, we also have alliances with other external organizations, such as the College of Pharmacists, for the prevention of type 2 diabetes with campaigns such as Diabetes in Your Neighborhood, with the support of the Diabetes Association. The Gregorio Marañón Hospital, collaborating with the endocrinology unit to address obesity. Scientific societies like the Spanish Heart Foundation and diabetes associations, either the local and the national one. We collaborate with them in the coordination of community activities, such as the National Nutrition Day, the Heart Week, or the Diabetes Race. Cities Changing Diabetes and the Alliance of Cities Against Obesity. participating with them in national and international projects in the prevention of diabetes and obesity. And finally, community relevant entities at a district level, looking for synergies with a health promotion approach. In 2020, due to the COVID pandemic and home lockdown, the ALAS program had to be adjusted to the virtual format to continue working on its goals in such adverse circumstances. For this, three main actions were carried out: the weekly challenges in food and physical activity, the Healthy and Economic Food Project, and the study on the impact of the lockdown on the habits of participants in the ALAS program. About the first one, since April 2020, weekly challenges on nutrition and physical activity were published on the Madrid Salud website. We were providing recommendations, the challenge that was posted for that week, tips to achieve it, and physical activity recommendations, including a web link with some exercises. 10 challenges of different foods were raised, such as fruits, legumes, nuts, vegetables, dairy products, and so on. During 2020 and 2021, in a context of health, economic, and social crisis due to the COVID pandemic, the ALAS program saw an opportunity to promote the consumption of healthy and affordable food. So we launched the Healthy and Economic Food Project with three objectives: to promote a healthy and affordable diet among the population, to provide tools that make easier the consumption of healthy and sustainable food, and to give information on how to plan healthy and economic menus. Simple and specific information about healthy food is provided using visual images with the idea of attracting people to read them. Healthy menus and recipes are already planned, including the estimated price of each meal per person, as you can see on the slide. We also have videos and small guides about buying groceries, healthy cooking, how to understand labeling, about zero waste cooking, and about seasonal food. Also, in this period, a study was carried out to find out the impact of the lockdown on the habits of the people that were participating in the ALAS program and whose intervention was interrupted due to the pandemic. The main results of the study were that participants maintained healthy habits in their diet. 60% of them lost any amount of weight, and 30% achieved the objective of losing more than 5% of their initial weight. 25% of the participants increased their physical activity. In addition, three other research and evaluation studies, as you can see on the slide, please next. Please next. Next. And next. Okay, thank you. Here you can see three other research and evaluation studies that we have performed with the help of the CCD project, like the rules of Halby's analysis that have been performing in most of the city in this project. Okay, in January 2022, our latest project began. It is the Childhood Obesity Prevention Project. The goal is to promote a healthy lifestyle among children to improve their quality of life and prevent childhood obesity. It is aimed at children aged 6 to 12 years, especially those who are overweight or who have obesity and their families. We are carrying out a pilot project in 12 schools with almost 3,000 children with the aim of extending it to other centers. A population intervention is carried out in the school environment and with the students and their families. through games and group workshops. We also do a high-risk intervention with children who are overweight or who have obesity. We work individually, in groups, and with physical activity. And here you can see some pictures about this childhood obesity project. To conclude, we would like to highlight the following conclusions about the ALAS program. We work non-stop to promote healthy lifestyles for the citizens of Madrid. We have established multiple community and group intervention with people of all ages. The ALAS program is effective in addressing obesity and preventing type 2 diabetes. It has been successfully implemented in the workplace. We work very hard to create and consolidate alliances with other organizations. The program adapts to different circumstances and changing formats and projects to continue working for its goal. We continue with the former lines of work and opening new intervention projects. We want to recognize all our colleagues, the efforts and enthusiasm they bring to this program. The ALAS program is the work of a great team. We finally would like to thank the support and the collaboration of CCD in the ALAS program. We are very glad to be part of this international network, allowing synergies and learning from each other. Thank you very much for your kind attention. We hope you have enjoyed the presentation. Now we would like you to watch a 3-minute video about the ALAS program. And after the video, we will be happy to answer your questions. Thank you.
Un estilo de vida saludable, realizando una alimentación sana y equilibrada y practicando una actividad física de forma regular, mejora la calidad de vida de las personas y previene enfermedades crónicas tales como la obesidad, la diabetes tipo 2 y las enfermedades cardiovasculares. Para conseguir vivir de una forma más saludable es fundamental trabajar sobre los factores sociales y ambientales que nos rodean.
The Food, Physical Activity and Health Programme promotes a healthy lifestyle, encouraging healthy eating and regular physical activity. It has been developed in the network of municipal community health centres distributed throughout the city of Madrid, carrying out group and community activities aimed at the entire population of any age. It also works with groups or individually with people who are overweight or obese, or being at risk of diabetes. Madrid Moves. Walking People was born as a European project with the aim of promoting physical activity among citizens, creating a suitable and simple environment for walking around the city. Thus far, 21 routes have been pointed out in the town districts, with more than 100 kilometers of healthy promenades. There is a mobile application as a guide to make the walks easier. Madrid Eats Healthy. One of the projects that articulates the strategy is that of healthy and low-cost food, that aims to collaborate and help in the change towards a healthier lifestyle, providing weekly menus with recipes that recommend healthy, balanced meals based on the Mediterranean diet at an affordable price. In addition, practical advice on eating is offered, with simple and specific information to prepare a healthy meal. Madrid versus obesity and diabetes. The program works intensively with people with obesity and a high risk of suffering from type 2 diabetes to improve their diet and physical activity, reduce their body weight, and prevent this disease. Since 2018, the City of Madrid has been part of the international project named Cities Changing Diabetes, which aims to reduce the incidence of diabetes in the participating cities.
El programa ALAS te ofrece consejos y apoyo para mejorar tu alimentación y tu actividad física. Trabajamos de forma intensiva con personas que presentan exceso de peso y alto riesgo de diabetes tipo 2 para mejorar sus hábitos de vida, reducir su peso corporal y de esta manera prevenir las enfermedades relacionadas. Y recuerda, un estilo de vida saludable añade años a tu vida y vida a tus años. Seguro vivirás mejor.
Thank you very, very much for your presentation. I think we're really privileged to have Alas as part of the Cities Changing Diabetes program, because I think, and this presentation demonstrates the comprehensive approach that you are taking across the board, working with vulnerable groups, working with children, working to redesign urban neighborhoods, working with diets and so on. So there's no quick fix, I think, and you are a good demonstration that you need to do many things to improve the health of people. So thank you for the presentation and also the video. Now we will go to a question and answer session where I will get questions in on the screen I have over there. If you online would like to pose a question, then click the question mark and then write it in. And then we will take as many questions as we can. And here's actually one about the coordination with the social services. So how do you coordinate with the social services or other entities who work with vulnerable populations? Are the workshops and activities adapted to the different groups, or what is your approach to make it relevant for those specific vulnerable groups? I don't know. I think you can decide who wants to answer this.
Okay, to coordinate with social services and being able to reach vulnerable population, we had to do it in different levels. First of all, we need a coordination in the central level among two municipal areas, the social services and the health promotion one. Then we also coordinate within the different districts. Here, the role of the community health centers is very relevant, especially the role of our colleagues, the social workers, which are our main link with the different social services centers and the rest of the entities. Moreover, we do a lot of community work in the field. We try to work close to people, and in this work, we have a lot of possibilities to get to know other entities, get to work with them, participate with them in different projects and activities for this especially vulnerable population. And that's how I see it, more or less. No, I don't know.
Yes, and it's difficult to explain all the adjustments that we have made, because we had different groups since 2011. For example, we are working with people who are living a very special vulnerability, like, for example, mental disabilities, mental disorder people, for example. And we take into account the traditions, because we work also with different ethnics, like, for example, Gypsy people, Latin American people, don't know, Muslim people, for example. So all the time we are fitting into the different circumstances.
It's super interesting. I saw the the results of your interventions was really interesting when it came to weight loss, how many lost weight and how much they lost, and so on. They were the proportion who lost more than 5%. And I could see that you had both a pre-COVID survey, and then you also had a COVID survey. And I couldn't help but seeing that during COVID, the weight loss was a little bit less. Fewer people had lost weight. What's your reflection on this? I mean, how you during the pandemic? What was the limitations, and what did you try to do to still reach out to the vulnerable populations and do that? I think when we look everywhere around the world, it has been extremely difficult to work in situations like yours. But I would be happy to hear your experiences from that.
Yeah, really, we think that we did a very relevant work during the COVID-19 lockdown. Mm-hmm. Our centers were never closed, and we tried to contact all entities and remind them that face-to-face attendance was still possible, of course, with COVID safety measures. Users were also contacted by telephone when needed, no? Especially vulnerable population. Also, online information about healthy habits was provided. We adjusted the content and suggested activity for this unusual situation. After the strict weeks of lockdown, we tried to organize many actions to reach as many people as possible to get back to normal activities. For example, we settled tents all over the city in different locations with information about COVID and our programs. We tried to go back to outdoors activities as soon as we could. For example, the Nordic routes, the walking people routes. We organized online workshops for those people whose workshops were interrupted during the pandemic. And of course, when we could do that workshops, I don't know how to say it, in person, we invited them to come again to our centers. And interestingly, since more solitude was detected during the lockdown and afterwards, we contacted and invited people to the group activities through another program of Madrid Salud that aims to prevent the unwanted solitude.
Thanks. I think in many places around the world, we have seen an impact on mental health of COVID. A lot of people have been isolated, and if you have been living alone, that has probably been even worse. Is that also something you have seen in Madrid? And I understand that you kept your centers open to the extent possible and tried to do specific outreach. But have you also seen a negative mental health impact in Madrid during COVID and an impact on health there?
O sea, sí hemos visto un impacto negativo en la salud mental, ¿no? O sea...
Yes, we haven't got now results here, but yes, of course, it's everywhere in all the world that the mental health is damaged.
Yeah.
So in Madrid Salud, we not only we have a LAS program, we have a specific program for mental health. So we coordinate with them and to improve the health people with, for example, how could I say, Soledad, Darío,
solitude. Unwanted solitude.
To give people the opportunity to work together to improve their mental health. But now I don't know how to answer specifics with results.
we will need our colleagues of the mental health program to try to answer this question more specifically. But of course, that as everywhere in the world, the mental health has been worsened due to the pandemic. And there's a good transfer of users between our different programs. So that's why we connect the ALAS program with the Unwanted Solitude program and so on.
There is
That one thing AI has been said that solitude has increased since 2018 to 2021 in 3 points, of 10.2% to 13.4%. So yes, the pandemic has been increased mental problems, and this in Solidarity.
Thank you. So your program has now been in existence for almost 12 years. And in your view, what has been essential for the long-term sustainability and the success of the program? We have, and I will come back to that, other cities that are calling in. What would be your advice to them? What to focus on? What to prioritize? So to do the right things first and maybe avoid some of the mistakes that you make early on. Thank you.
Yeah, I believe that there are some essential aspects to the initiation and the sustainability of this project. I think is very important the political and institutional support because that provides human and materials resources. I think it's very important to are convinced that the importance of working in health promotion to improve quality of life and prevent chronic diseases. And we really believe in it. No?
Yeah.
It's necessary to have a network of centers with different professionals with different background, and it is important also that Darío said in the work in the community to be close to people, close to entities of the neighborhood, and because this eases our work. No? The alliances are very important también, I think, but the essential thing I think is the effort and motivation and the commitment of the professional team. We have this kind of colleagues, and without this we couldn't have had these successful results. I think these are the more essential things.
Yeah.
You have anything?
No, that's right.
It's okay.
Okay. Then to a question that we got from Milos in Belgrade in Serbia. So from Cities Change Diabetes in Serbia. And maybe it's just a request rather than a question. Is it possible to get more detailed pieces of information regarding the physical activities conducted within your project? We saw some of them today, the slides about the walking routes and the app, because it would be useful for CCD in Belgrade project to learn about this project. And he says, congratulations on your achievements so far.
We don't actually each year we have a new route, at least or two, and we do several activities groups where we focus in physical activity. So we find people to do that activities from other workshops or other programs, and always with the activities we are talking about physical activity. So
any program that we work in our centers, they can participate in the working people on in Nordic working and so on.
Yeah.
I would like also to add that the coordination with the public sports centers is very, very important for this issue because there's a good collaboration. So they can send people to our centers. We can send people to their centers. So it's a very important synergy between the two areas.
And I think I would also say that, of course, in addition to this presentation today, if you go to the website of Cities Change Diabetes, there is a link to ALAS, and we can also make sure that you get in contact with a team here to learn more if you are interested. Then there's a question from Leah about when you work in the workshops with patients or people at risk. Do you provide any incentives, cash, prizes, food, whatever, in addition to the positive health results that they get out of it? It's a good thing to lose weight, and it's good to be exercising more and you feel better. But do you do something in addition to get people to have a healthier diet and or exercise?
Yes.
We wish we could give some present to the people that comes to our workshops, but no. The main present they receive is the change in their habits. No. Also, I think that. When you are in a workshop, the fact of being in group is very rewarding for our users and also for we. Usually we talk among us, among professionals, that they learn from professionals, but we learn from them a lot as well. So it's the main fact. The fact of being in group is rewarding enough, I think. For some other activities, community activities like these tents that we place on the street, usually we have some presents, no, like pins, hats, and things. Yeah.
With child, we try to give them some presents. But this one thing that a woman told me, that not only she had improved her habits, but she had a very good friendship with another woman who participated in the workshop. So the psychology aspect is improved with the workshops and with the routes, with the working people routes, and they improve their mental health. Sorry.
So, you've been working with this for more than a decade, and I think the results are impressive, and you are, of course, experts. And changing behavior is really, really difficult, particularly if you want to change behavior permanently, more healthy, more exercise, and so on. And I'm just, I would like to, I would like to ask you, what is easiest? Is it to get people to exercise more, or is it easier to change food habits? If you could choose one, what do you think is the easiest?
I think it's exercise more.
Exercise. I don't know.
Why is that?
Because
Maybe.
Everything, but I think exercise more because improves more your mental health. You share with other people. You can go outside because now it's very important after pandemic.
You can find time in your life to practice the physical activity.
Well, for some people it's difficult to find the time, but if you have it, it's better to improve your exercise than your habits. But everything.
In my experience with groups, I find like these two profiles: people who starts with diet, and then step by step they go into exercise. But there's a smaller group that maybe they prefer to start with exercise, and then they start with the diet. So there are the two profiles, but I think
because they start to be motivated to get better. So
but it's good
they introduced.
But it's good to know, and maybe, of course, people are different, and different things motivate people in different ways. So that is, but of course, good that you work on all aspects of improving the lifestyle, whether it's exercise and diet. I'm afraid we don't have more time for more questions because the time is almost up. So I hope for the ones who watched online that this was inspirational, that you got some exciting things out of this and some learning that can be used in the city or the neighborhood that you are in. This recording will be available on YouTube. You can go to YouTube and search for Cities Changing Diabetes, and then you'll find the different versions of CCD Rounds, including this one. If there are further questions to what we have discussed today, or you want to get in contact with the team online, please write to info@citieschangingdiabetes.com. That will come to our mailbox, and then we'll make sure that it gets to the team who's online, and then we can continue the sharing and the learning. And as I said, also on our website, citieschangingdiabetes.com, we have a small write-up of the best practice of Madrid Salud and Alas that you can read more about. The next CCD round will be in September, so we are taking a summer break now. Summer comes early in Denmark, so we will be going on vacation soon, and then the rest of the world will follow typically in August, as I think you normally are on vacation here in Madrid. And here we will present or hear about the action research program called Football is Medicine. And if you like football, maybe there's a good opportunity to see how football can be used also to help reduce the risk of diabetes and other chronic diseases. So what is left for me is to thank the team online from Madrid, Antonio Pietro, Mercedes Senos, Vanessa Sanz, and Dario Ochoa for your contribution and your excellent presentation today. Thank you, everyone, and have a wonderful day.